Welcome to the Dairy Worker Health and Well-Being Training. This training will focus on the importance of your health and well-being as an employee of your dairy farm. Let's begin. This work is supported by grant number 2020670233290 from the United States Department of Agriculture, USDA, National Institute of Food and Agriculture, NIFA. Any opinions, findings, conclusions, or recommendations expressed in this training are those of the content creators and do not necessarily reflect the views of the USDA. Each day, we learn more about COVID-19. The information we present in this training is based on what we know at the time of this recording, November 2020. Upon completion of this training, you will be able to explain the importance of your health and well-being as an employee of your farm, describe the current situation of COVID-19 on dairy farm operations, explain how to prevent COVID-19 transmission on your dairy farm and your home, explain how to prevent other respiratory diseases on your farm and your home. Workers in the U.S. agriculture, forestry, and fishing sector face serious occupational health and safety challenges. This graph shows that there were 570 fatal work injuries in 2018 in the ag sector. Compared to other jobs in the ag sector, the dairy industry has a high occurrence of worker fatalities. There were 46 deaths in 2016. Additionally, dairy workers experience non-fatal injuries, in particular musculoskeletal injuries and pain, which affect nearly 80% of the workers. Another serious concern is the possibility of worker-to-worker transmittable diseases and work-related zoonotic diseases. Zoonotic diseases are diseases that can spread between people and animals. For example, workers can catch diseases from cattle, and cattle can catch diseases from workers. Other possibilities are cattle to cattle and worker to worker. Zoonotic diseases can be caused by different germs called bacteria, viruses, fungus, or protozoa. Let's talk a little bit about the differences between bacteria and viruses. Bacteria and viruses may cause illnesses that symptomatically look and feel the same, but bacterial and viral infections are not diagnosed and treated in the same way. Bacteria are small living germs that can be treated with antibiotic medicine. This is different from viruses. Viruses are much smaller and are not living germs. Viruses are treated with antiviral medication. Also, vaccines meant for viral diseases do not provide protection, also called immunity, against bacterial diseases. Similar, vaccines for bacterial diseases do not provide protection against viral diseases. Dairy workers can also contract other disease-causing germs from coworkers and the environment. These diseases can also be caused by bacteria, viruses, fungus, or protozoa germs that can be transmitted from worker to worker through the air, through direct contact, contact with contaminated work equipment, oral ingestion, and by insect bite, and can also cause respiratory, diarrheal, skin, and neurological diseases. Here are some examples. Coronavirus and influenza, or the flu, are both caused by different viruses. Tuberculosis is caused by a bacteria. These diseases can be transmitted through the air from a sick worker to a healthy worker. Notice that there is a vaccine for the flu. Some years the vaccine is very effective. Other years it is not very effective. Other diseases have vaccines too. Those vaccines are specific to the disease and do not protect against other diseases. This means that the flu vaccine will not protect you from the coronavirus nor tuberculosis. However, this year, getting the flu vaccine is very important because it can reduce your chances of having both the flu and the coronavirus infections at the same time. Public health departments recommend getting the flu vaccine every season, which happens between October to January of every year. Tetanus, a bacteria germ, can be introduced into the bloodstream from a cut, burn, or blister exposed to contaminated heavy machinery or equipment. If not previously vaccinated, a tetanus infection can result in muscle stiffness and interfere with the ability to breathe, potentially leading to death. Ask your doctor about the Tdap vaccine or booster vaccine, which covers tetanus, diphtheria, and pertussis diseases. This vaccine can be received any time of the year and is recommended every 10 years. The good news is that prevention is easy. This health and well-being training will focus on some of these diseases and how you can help prevent transmission both at work and at home. You might be used to these germs at work, but you can take these germs home and expose individuals with weakened immune systems like the elderly, children, and immunocompromised individuals. Wearing your personal protective equipment, having good hygiene practices, and staying healthy with a balanced diet, daily exercise, and hydration can keep yourself, your family, your coworkers, and the cattle healthy. You have been selected to participate in this new training program because you are a dairy worker and an important and essential worker in the U.S. Your employer is committed to your health and safety and would like to start this new program on the farm to train everyone on the importance of health and well-being. The purpose of this training is to help you understand the importance of your health and well-being as an employee of your farm, as well as understand how to prevent the transmission of respiratory diseases not only on the farm, but at home. Let's begin. Next, we are going to discuss tuberculosis. One health hazard on the farm is a potential exposure to a respiratory disease called tuberculosis, or TB. TB is caused by a bacteria germ. These bacteria usually attack the lungs, but TB bacteria can also attack any part of the body, such as the kidneys, spine, and brain. 1 out of 4 people in the world are infected with TB. In 2019, 1,161 cases of TB were reported in Texas. This was a 3% increase from 2018. In addition, 53% of reported TB cases in 2019 were among Hispanics, 16 were among African Americans, 10 were among whites, and 20 were among Asians. Let's look at how TB can spread, its symptoms, how it's diagnosed, and how it can be treated and cured. So how does TB spread? TB bacteria are spread through the air from one person to another. TB disease in the lungs or throat can be very infectious. This means that the bacteria can be spread to other people. TB in other parts of the body, such as the kidneys or spine, is usually not infectious to others. The TB bacteria are put in the air when a person with TB disease of the lungs or throat sneezes, coughs, speaks, or sings. People nearby may breathe in some air particles that contain these TB germs and become infected. TB is not spread by shaking someone's hand or hugging, sharing food or drinks, touching bed linens or toilet seats, sharing kitchen plates, cups, and utensils, or kissing. People with TB disease are most likely to spread it to people they spend more time with every day. This exposure risk includes family members, friends, and dairy farm coworkers. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs. Doctors can make a distinction between two TB conditions: active TB and latent TB disease. Active TB disease in the lungs may cause symptoms such as a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, the phlegm from deep inside the lungs, weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. People who have latent TB infection do not feel sick, do not have symptoms, and cannot spread TB to others. How can you get tested? There are two kinds of clinical tests that are used to detect TB bacteria in the body. One, a skin test, and two, a blood test. For a TB skin test, a small needle is used to insert a small amount of fluid called tuberculin into the surface of the forearm skin. After 48 to 72 hours, you return to the same clinic to have your forearm examined and measured. If the injected area has a reaction, the spot will be raised, hardened, or swollen. For the TB blood test, a vial of blood is extracted from the arm. With this test, you do not have to return to the clinic. The clinic staff will call you with your results. This is the preferred test for individuals previously vaccinated for TB. The TB vaccine does not give lifetime protection to TB. If either the skin test or the blood test are positive, you will be asked to return to the clinic for a chest x-ray or a sample of saliva. These follow-up exams are needed in order to rule out if a person has TB disease. Not everyone infected with TB bacteria becomes sick. Earlier, we mentioned two types of TB-related conditions, latent TB infection and active TB disease. Both latent TB infection and TB disease can be treated with specific antibiotics. Without treatment, latent TB infection can progress to active TB disease. If not treated properly, TB disease can be fatal. It is very important that people who have TB disease are treated, finish the medicine, and take the drugs exactly as prescribed. If they stop taking the drugs too soon, they can become sick again. TB disease can be treated by taking several drugs for 6 to 9 months provided by the health department staff to your home. In addition to the human version of tuberculosis, there is a bovine or cattle version of TB called bovine tuberculosis or bovine TB. Bovine TB is predominantly found among cattle and other grazing animals like deer. However, bovine TB can also be transmitted to humans. People are most commonly infected with bovine TB by eating or drinking contaminated, raw, or unpasteurized dairy products. The pasteurization process is very important because it destroys disease-causing germs in the milk, like bovine TB. It is important that you do not drink or take home unpasteurized milk from your dairy farm. Tampering with the milk tank or milking process puts both your health and the quality of the milk at risk. Another way people are infected with bovine TB is by working in close proximity with infected cattle. The bacteria that causes bovine TB is found in an infected cow's saliva and wounds, and the bacteria could spread through the air. The risk of exposure is greatest in enclosed areas, such as barns with poor ventilation. Animals, like cattle, often do not show signs until the infection has reached an advanced stage. In these later stages, clinical signs of bovine TB among cattle may include weight loss, lethargy, weakness, anorexia, low-grade fever, and pneumonia with a chronic moist cough. Lymph nodes may also be enlarged. If you come in contact with a cow exhibiting these symptoms, you should isolate the animal immediately and then call your veterinarian or immediate supervisor for diagnosis. If you were directly exposed to infected cattle, you may or may not develop TB. However, the people who become sick will do so within a few weeks or months after becoming infected. Bovine TB is treatable, so it's important you monitor your symptoms and contact your local clinic to schedule a testing appointment. Next, we are going to discuss coronavirus or COVID-19. Near the end of 2019, in a city in China called Wuhan, doctors noticed an increase in the number of people with a new type of respiratory disease. Because it was new, scientists called the new coronavirus novel. This disease rapidly spread throughout China and to other countries throughout the world. Since its discovery, more than 43 million people in the world have been confirmed to be infected by the coronavirus, causing more than 1 million deaths and inflicting widespread health and economic devastation. In the US, there have been over 8.7 million COVID infections and over 225,000 deaths. The spread of the virus in the U.S. has raised concerns about the public health and economic impact, including dairy production. On March 2020, the U.S. Department of Homeland Security declared agriculture, including the dairy industry, as an essential component of the nation's critical infrastructure. This means that agricultural employees, like yourself, are very important to continue milking operations in these challenging times. There are many types of human coronaviruses. COVID-19 is a new disease caused by a new coronavirus that has not previously been seen in humans. COVID-19 has greatly affected Hispanic, African American, and Native Indian communities in the U.S. While there are many unknown factors for increased risk of COVID-19 among these minority communities, the high prevalence of diagnosed and undiagnosed and controlled and uncontrolled chronic diseases such as diabetes, high blood pressure, high cholesterol, obesity, and heart disease can increase the risk of COVID-19 disease severity and progression to hospitalization and death. As of August 2020, hospitalizations due to COVID-19 were 5 times greater for Hispanics compared to whites. Since this is a new disease, some of the information about it changes fast. As time passes, we are learning new things about COVID-19. We created this health and safety training to provide you with the most current information about COVID-19 to date. The virus spreads mainly from person to person. Once you are infected, you can spread the virus in your workplace, at home, and in your community. Here are some ways coronavirus can be transmitted. Through the air. Coronavirus spreads from person to person mainly through the air. Saliva droplets are released from our mouth when we sneeze, cough, talk, sing, and laugh. When you are near an infected person who is not wearing a mask, you are at risk for inhaling the saliva droplets that have the virus. Most of these droplets fall out of the air within 6 feet. For these reasons, keeping a safe distance of at least 6 feet between you and others and wearing a mask are both good practices to help prevent transmission. By touching surfaces. The coronavirus may remain alive on frequently touched surfaces. Depending on the material of the surface, the virus can survive for hours or days. For this reason, frequently cleaning and disinfecting surfaces will help prevent COVID-19 in our workplaces and our homes. Food. So far, there are no news of the virus being transmitted in food. However, before preparing or eating food, it is still important to always wash your hands with soap and water for at least 20 seconds for good hygiene and food safety. Some people with COVID-19 have no symptoms, others have very mild symptoms, and some others have severe symptoms. These symptoms typically appear between 2 and 14 days after being in contact with the virus. People who are infected with a virus but never have symptoms are called asymptomatic. Although infected, asymptomatic people look healthy. Asymptomatic people can still spread coronavirus. People who are infected with the virus but do not show symptoms at the time they were tested are called pre-symptomatic if they show symptoms later. Pre-symptomatic people can also spread coronavirus. People who are infected with a virus causing COVID-19 and who have symptoms of the disease at the time of testing are called symptomatic. People with COVID-19 typically have one or more of the following symptoms: fever above 99.5 degrees Fahrenheit or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. This list does not include all possible symptoms. The Center for Disease Control and Prevention, or CDC, We'll continue to update this list as we learn more about COVID-19 disease. Coronavirus affects different people in different ways. Infected people have had a wide range of symptoms reported, from no or mild symptoms to severe illness, hospitalization, and death. Most people with coronavirus will have mild to moderate respiratory illness symptoms that do not require hospitalization and can be treated at home with over-the-counter flu and cold medication, hydration, nutritious food, and rest away from others. Mild disease symptoms may include a low-grade fever, over 99.5 degrees Fahrenheit for adults, nasal congestion, runny nose, sore throat, mild dry cough, and mild body aches or soreness. In cases of severe disease, look for emergency warning signs for coronavirus. If someone or yourself is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility and notify the operator that you are seeking care for someone who has or may have COVID-19. If you are sick with coronavirus or live and or work among someone who is positive for coronavirus, it is important to self-isolate and distance from others, especially children, elders, and people with weak immune systems. If you are sick with coronavirus or think you might have been exposed, follow the steps below to care for yourself and to help protect others in your home and at work. Stay home from work and stay away from other public places. Monitor your symptoms carefully. Check your temperature and ability to breathe. Get rest and stay hydrated. Cover your cough and sneezes. Wash your hands or sanitize your hands frequently. Stay in a specific room and away from other people in your home. If available, use a separate bathroom. If you need to be around people in or outside your home, always wear a tight-fitting face covering. Avoid sharing personal items like dishes, towels, and bedding with other people in your home. Disinfect all surfaces that are touched often, like counters, tabletops, doorknobs, and light switches. If your symptoms get worse, call 911 and notify the operator that you have or may have coronavirus. When you can be around others and end your home isolation depends on different factors for different situations. 1. For anyone who have tested positive but have no symptoms, you can be around others after you stay home for 14 days and monitor your symptoms closely. 2. If you think or you know you had coronavirus and had symptoms, you can be around others after 10 days since symptoms first appeared and 24 hours with no fever without the use of fever-reducing medications, and coronavirus symptoms have improved, for example, an improved cough, shortness of breath, sore throat. Most people do not require testing to decide when they can be around others. However, if your healthcare provider or workplace recommends testing, they will let you know when you can resume being around others based on your test results. Note that these recommendations do not apply to persons with severe coronavirus or with severely weakened immune systems that were hospitalized. Dairy producers and workers can help prevent and slow the spread of coronavirus on the farm. This can be done by identifying and applying control measures to eliminate or reduce exposures to coronavirus. Preventing the transmission of coronavirus on the farm is important. Equally important is continuing these prevention measures at home. Remember, Coronavirus prevention does not stop when you get home. Next, we will cover prevention measures while working on the farm and while living at home. The successful operation of a dairy farm depends on healthy workers. Prevention of coronavirus transmission at your dairy farm is essential for your health. Here are several things you can do at your farm to prevent the transmission of diseases like coronavirus, the flu, and TB. Follow these 5 steps every time you wash your hands. 1. Wet your hands with clean, running water. Turn off the tap and apply soap. 2. Lather your hands by rubbing them together with the soap. Lather the backs of your hand, between your fingers, and under your nails. 3. Scrub your hands for at least 20 seconds. Need a timer? Sing or hum the happy birthday song from beginning to end twice. 4. Rinse your hands well under clean running water. 5. Dry your hands using a clean towel or air dry them. Washing hands with soap and water is the best way to get rid of germs. Sometimes on remote parts of the farm, it's hard to access soap and water. Instead, you can use alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. Sanitizers can quickly reduce the number of germs on the hands in many situations. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when washing hands are visibly dirty or greasy. Hand sanitizers might not remove harmful chemicals from hands like pesticides and heavy metals. How to use a hand sanitizer. First, apply the gel product to the palm of the hand. Rub your hands together. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Sing or hum the happy birthday song from beginning to end twice. You should wear a mask in public and when around people who do not live in your household. Masks should not be worn by children under the age of 2 or anyone who has trouble breathing, is unconscious, incapacitated, or unable to remove the mask without assistance. How to wear your mask correctly. Wash your hands for 20 seconds or more before putting your mask on. Put the mask over your nose and mouth and secure it under your chin. Try to fit the mask snugly against the sides of your face, and make sure you can breathe easily. Limit close interactions with coworkers. The milking parlor, maternity, and hospital operations are areas that often necessitate close interactions. Stay at least 6 feet apart from coworkers. This is the equivalent of the length of a cow or 2 grocery store carts. Alter communication methods with coworkers to mitigate possible virus transmission. Communicate via work radios or cell phones. When in-person communication is essential, make sure you and your coworkers are properly wearing your face coverings and are distancing as much as possible.
A day on the farm often involves a lot of hands-on work, and many hands at that. This means reaching for or touching the same tools, objects, or other surfaces throughout the day. These are called high-touch surfaces, and you will likely come into contact with them as soon as you get to work, whether it's opening a door, turning on the lights, or grabbing a cup of coffee. When many people share the same tools and objects, germs can spread easily. This is even more important to remember during the COVID-19 pandemic. COVID-19 is a disease caused by a virus. People can spread it very easily, even if they don't feel sick. When someone coughs, sneezes, or talks, their germs can spread out in the air. Others can get sick by breathing them in. Germs can also land on surfaces. When you touch them and then put your hands to your eyes, nose, or mouth, you could get sick. That's why you should always wash your hands before touching your face. There's a lot of information out there about COVID-19. All of the do's and don'ts can get confusing. There is some good news. Some of the most important steps you can take are simple, like cleaning and disinfecting. Clean hands keep germs from spreading. Soap and water can break down COVID germs and wash them away. To protect yourself and others, wash your hands well and wash them often. To do it right, you need to scrub your hands all over for at least 20 seconds. Then rinse, dry with a clean paper towel, shut off water with a paper towel, and throw it in the trash. If you can't wash with soap and water, use hand sanitizer. Just make sure it has at least 60% alcohol. Rub it in until your hands are dry. It is also important to clean and disinfect high-touch surfaces at work as well as at home. If a surface is dirty, you need to clean it first to get the dirt off. Use soap and water and scrub it with a sponge, brush, or cloth. If you wear reusable gloves, wash your hands before you put them on. Disinfecting means using chemicals to kill invisible germs on surfaces. There's a list of products that can be used against COVID-19. You can find it here. You can make a bleach solution to disinfect surfaces. Mix 1/3 cup of bleach with a gallon of water. Whenever you use a chemical, safety is important. Always read the label, wear the recommended protective equipment, and use only in areas where there's good airflow. Store chemicals, including bleach, out of the reach of children. To kill germs with bleach solution, you'll need to mix it fresh daily. And make sure the surface stays wet for 10 minutes. When you're done, carefully take off disposable gloves so you don't touch the outside. Wash reusable gloves with soap and water before you take them off. After removing your gloves, always wash your hands with soap and water for at least 20 seconds. During the course of a workday, there are so many shared items you might touch. If you pick up germs from one, you can spread to another, including your phone. To disinfect your phone, the CDC recommends using wipes or spray that contain at least 70% alcohol. First, power it off and make sure it's not plugged in. Wipe surfaces with alcohol and make sure it's dry before you turn it back on. Remember, germs can spread easily on the farm. Clean and disinfect regularly to protect yourself and protect others.
Where appropriate personal protective equipment, known as PPE, this includes gloves, aprons, boots, safety vest, safety glasses, proper ear protection when necessary. PPE also includes a cloth face covering to be washed daily and replaced as needed. Make sure to clean or launder all work uniforms and cloth face coverings daily. For disposable masks made of layered paper material, do not reuse and do not wash them. Simply discard after use. Launder uniforms. Depending on your farm, work uniform cleaning services may be routine. If these services are not offered on your farm, make sure to launder all work clothes daily. Do not reuse dirty pieces of clothing. Use regular laundry detergent and the hottest water setting available in your machine. Wash cloth face coverings. Masks should be washed after each use. You can include your mask in your regular laundry. Use regular laundry detergent and the warmest water setting available in your machine. Do not allow non-essential off-farm visitors on the farm. When essential off-farm vendors come onto the dairy farm, their visit should be recorded with visitor name, phone number, purpose of visit, and times of arrival and departure from the farm. This information will make contact tracing easier in case of a positive case. Off-farm visitors should wear a mask at all times. They should wash and sanitize hands frequently, and they should limit their time interacting with workers. So far, there are no news of the virus being transmitted in food. However, before preparing or eating food, it is still important to always wash your hands with soap and water for at least 20 seconds for good hygiene and food safety. There is a possibility that a person can get COVID 19 by touching a surface or object, including food or food packaging, that has the virus on it, and then touching their mouth, nose, or eyes. This is not the main way coronavirus is transmitted, but there are some easy prevention tips. Do not share food with coworkers who do not live in your household. Food delivery vendors should be organized on a prepaid basis with payment and delivery of orders taking place away from farm operations. Social lunch visits by family members should not be allowed on the farm. Workplace prevention measures are important to prevent transmission of COVID 19. Equally important is continuing to apply these prevention measures at home. Remember, COVID 19 prevention does not stop when you get home. Next, we will cover at home COVID 19 prevention strategies. Proper ventilation with outside air can improve indoor air quality. Increasing ventilation, along with other best hygiene practices, can be part of a plan to protect yourself and household members from coronavirus. To increase ventilation in your home, you can open the windows or screen doors if possible, and operate a bathroom fan when the bathroom is in use and continuously if possible. Social distancing means keeping a safe distance between yourself and other people who are not from your household. To practice social or physical distance, stay at least 6 feet from other people. Social distancing should be practiced in combination with other everyday actions to reduce the spread of COVID 19, including wearing a mask, avoiding touching eyes, nose, and mouth with unwashed hands, and frequently washing hands with soap and water for 20 seconds or more. Try avoiding the following places: dining in at a restaurant. Instead, choose curbside pickup or delivery. Hosting large gatherings or cookouts. Instead, meet with less than 10 non household members outdoors and stay 6 to 10 feet apart. Attending an event or gatherings. Using gyms or fitness centers. Going to nail salons, barbershops, or hair salons. Develop a plan as a family to protect household members who are at increased risk for severe illness. This can be a written plan or a plan you discuss with your household. Here are some planning topics: hand washing and sanitizing, avoiding touching eyes, nose, and mouth, disinfecting commonly touched or used objects. Make sure disinfecting assignments are clear. For example, Mondays and Tuesday mornings and evenings are assigned to one person, and Wednesdays and Thursday mornings and evenings are assigned to another person, and so on. Properly wearing a mask in public. Social distancing from non household members. Restricting non essential visitors to your home. Canceling non essential travel or outings. Assigning one person to purchase groceries. Designating one quarantine room in the house. Assigning one not at risk person as a potential caretaker. Stocking up non perishable foods for 14 days. Plan to continue education and childcare. And knowing the main COVID 19 symptoms and what to do in case of severe disease. Having a discussion with your household about these planning topics can help with mitigating COVID 19 transmission in your home. The COVID 19 vaccine is one of the many important tools to help us stop this pandemic. The COVID 19 vaccine will help protect you from getting COVID 19. 2 doses are needed. The CDC is making recommendations for who should be offered the COVID-19 vaccine first when supplies are limited, but vaccine supply will increase in the weeks and months to come. This shot is especially important for you because you are an essential worker in the United States. Thank you for carefully viewing this health and well-being training. You will now take a short post-test and a satisfaction evaluation. Please hand the iPad tablet to your training administrator. Good luck!